St. James family and friends. For those of you who may not know, my name is Minister Deshonna Harrell, and I am a licensed practical nurse. So this month is the month of October, and we do know that this is Breast Cancer Awareness Month. So I'd like to share with you today just a little bit of information concerning breast cancer. Breast cancer is the most common cancer in American women except for skin cancers. It is estimated that in 2020, approximately 30% of all new women cancer diagnoses will be breast cancer. There are over 3.5 million breast cancer survivors in the United States. We'd like to take a moment just to thank God for all of the people that are breast cancer survivors. We thank God for making you his miracle and allowing you to receive the blessing of healing from him, that he may receive the glory of your testimony. Breast cancer is a disease in which cells in the breast grow out of control. There are different types of breast cancer. The kind of breast cancer depends on which cells in the breast turn into cancer. Breast cancer can begin in different parts of the breast, and the breast is made up of three main parts. It's made up of the lobules, the ducts, and connective tissue. The lobules are the glands that produce the milk. The ducts are tubes that carry milk to the nipple. The connective tissue, which consists of fibrous and fatty tissue, surrounds and holds everything together, and that's the full part of the breast. Most breast cancers begin in the ducts or the lobules. When it begins there, it is considered a non-invasive cancer, which means that it's in place and has not spread to the nearby tissue. You also have invasive breast cancer, and that has spread from the original site into nearby breast tissue. Breast cancer can spread outside the breast through blood vessels and lymph vessels. Now, when breast cancer spreads to other parts of the body, it is said to have metastasized. Breast cancer, again, can occur anywhere in the breast, but the most common location is in the upper outer section of the breast. It can be located near the surface or deep inside the breast, close to the chest wall. It can also occur in the armpit, where there is breast tissue as well, and this is considered the tail of the breast. Breast cancer is more common in the left breast than the right breast. The left breast is 5 to 10% more likely to develop a cancer than the right breast. The left side of the body is also roughly 5% more prone to a melanoma, which is a type of a skin cancer. Most inherited cases of breast cancer are associated with two abnormal genes, BRCA1 and BRCA2. That's BRCA, which stands for breast cancer. And men are just as likely as women to have an abnormal breast cancer gene. So yes, children can inherit this abnormal breast cancer gene from their father. The two genes, BRCA1 and BRCA2, have been shown to predispose to familial breast cancer, and that just means that the parent is able to pass down to the children, and it just passes through the family. BRCA1 mutations are also associated with an increased risk of triple-negative breast cancer. This is an aggressive and frequently difficult to treat cancer. BRCA2 mutations increase the risk of breast, ovarian, pancreatic, gallbladder, bile duct, and melanoma cancers. I know that these numbers may sound alarming, but it's very important to remember that only 5 to 10% of women diagnosed with breast cancer have a BRCA mutation. Black people diagnosed with breast cancer face unique challenges throughout their diagnosis. Despite increased breast cancer awareness among the public, issues of systemic racism, access to high-quality care, genetic differences, and other factors have caused dramatic disparities. African American women have a 31% breast cancer mortality rate, the highest of any U.S. racial or ethnic group. Among women younger than 45, breast cancer incidence is higher among African American women than white women. Black women are more likely to be diagnosed with a more advanced stage breast cancer compared to white women. The tumors of Black patients are also more likely to be larger and to have spread to the axillary, to the underarm, to the lymph nodes, which are the glands, at the time of diagnosis. So I encourage you to please be proactive. Please speak up for yourself. Please take the time to check yourself. You have to be your biggest advocate. If you don't understand, if you're not sure, please make sure that you ask questions.